The purpose of this video is to educate nursing staff on some of the new changes that will take place with the upgrade of our new Meditech 607 update. Some of the updates that will affect nursing include, but are not limited to, order entry, diet orders, TAR, home medication and allergy entry, as well as patient pharmacy entry. The changes that will be seen with order entry include that now some of the orders can be edited from the order string. So in the case of the order we're looking at here, you could make changes to any of the data that is in this red box with these drop-down arrows without having to necessarily go into the required edit tab that you see here. Not all orders will be able to be edited in this fashion. Diet orders are changing in the regard that now you can place multiple diets in one order. So if the patient is on a combined diet such as a cardiac, diabetic, calorie counted diet with a safety tray, where that could be 4 to 5 diets in our current ordering system, as we move forward that's going to be one diet order with all those additions made within it. We are now going to have the ability for more start time options. No longer are we going to have just breakfast, lunch, and dinner as ordering start times. Also, secretary and nursing are going to have the ability to cancel previous diets. There will be a secretarial task that will be populated to cancel previous diet orders once the physician enters a new diet order. There is also an updated diet list of ordering options. This is what the ordering for diets is now going to look like. On this particular patient, a diet of cardiac has been entered. If any additional diets wish to be added to this baseline diet, those can be done in this space here. This could be diabetic, a calorie count. With the diet consistency, this is where you could enter something such as pureed, honey thick. Type of tray would be behavioral tray or safety needs tray. All of this is now one order as opposed to consecutive orders. There is still the ability for physicians to enter any additional information that they'd like to add to that diet. The orders will still appear the same way that they always have in the Orders tab, as far as all of these diets will list out individually, even though they are entered as one. Our TAR is going to face two new changes. You're now going to see this warning in the middle of the screen that's in red. This is giving you a 30-minute time to start, 30 minutes to start your blood upon the retrieval of the blood from the blood bank. If you exceed that 30 minutes, then you are now going to have a required enter of a reason for exceeding that time. There is a dictionary of a few choices that have been acceptable from our policy as well as blood bank as to what you could enter here. But you must enter a reason before you can proceed with administering the blood product. The second change you're going to see with the TAR is that now there is a container volume. The container volume is how much blood was in the bag. This is never exact between any two units of blood. It will be entered by blood bank. It is an estimate. The important takeaway from this is that this container volume does not populate to our patient's INO. What will populate to the INO is what's always populated. Any of the intake that you enter in the TAR, such as the actual blood product itself, as well as any other intake, such as the saline that goes in before and after the transfusion, that will populate to the INO panel. You will go to this Doc Intake tab that you see at the bottom of your screen to put in any of your intake. And on the next screen, you're going to see what this looks like. The container volume was 350. The blood product was 320. and then the other additional amount was 30 in lieu of saline. So when you look at the total intake for this patient, you see they received only 350. It did not add the container volume and the blood. It just took in the blood and the other amount as total intake for the whole transfusion. In the I&O panel, it does clearly define what was actually blood product versus what was other intake. Our home medication entry has made some updates and changes as well. You now have these two tabs. In addition to just adding the name of the home med, you now can click on No Home Medications. This is to be used when the patient does not take any home meds. There is also an Unobtainable tab. The unobtainable is to be used when the patient's medications are not known. What's really nice about this new feature is that if you have ever entered one of these two options and then you come in to start making an entry, whichever of these two options was previously existing here will automatically go away, and then your new entry will fill in. So you do not have to go back and cancel either of these. It will automatically cancel whenever it receives a positive entry. The home medications entry screen is now going to look like this. It is now broken into individual sections. Each section will give you a check, a green check, meaning everything in that section is satisfied. If you receive a red question mark, that means there is missing data within that section that needs to still be answered. So if you know that the patient takes Tylenol and they're certain of it, then you're going to put it in a confirmed status. If the patient tells you they think they take Tylenol but they're not sure, you can put in Tylenol, and you can take the confirmed status and put it in an unconfirmed status simply by selecting this drop down arrow here and selecting unconfirmed. If you made that Tylenol unconfirmed, this will not be a green check, but it will be a red question mark to bring attention to either you to come back to it or the nurse behind you to come back to it. The same thing goes for all of these other boxes. If things are confirmed and satisfied, then you will not have a red question mark. You're going to notice in this information here with the medication string that we do have a red question mark right here in the instruction section, because that is where we are lacking data in regards to the frequency in which the patient takes the medication. Other changes that are happening on the physician side in regards to home meds and allergies is the physicians will now receive an alert if medications have not been addressed for this hospital visit. They will have an alert that says medications not addressed. Actually, it will say not updated more specifically. So that lets them know that they cannot safely reconcile those meds for the visit until they have been updated and addressed. Also, if you come back in an hour or two later with more data on the meds and you do come in and satisfy these fields and make this a green check, it will send an update to the physicians that says medications updated. So they are now being alerted to all activity that takes place within home medication as well as allergies. To better alert nurses to the need for home medications to be addressed, we have now added on the status board this home medications column, the HM standing for home medications. So if your patient has some information lacking or the medications have not been updated and addressed, you will see a red checkbox on your status board next to your patient's name. A red check does mean that something is not satisfied, either they're unconfirmed, unobtainable, or not updated. All you have to do from the status board is click right on the red check. It will launch you straight into the screen in which you add and update those home meds. If everything is satisfied within the patient's home meds, there will be nothing in this space. It will in fact be blank, meaning no attention is needed. Allergy entry is going to appear like this. You do have your No Known Allergies tab. You also have your Unobtainable tab. The new addition that you see here is you now have a tab for Add as Uncoded. So if you know that a patient's on has an allergy to a medication or any allergy, you will go ahead and select Add as Uncoded, and so you do not have to go into the edit to do that. You can enter numerous patient allergies. If they have multiple allergies, you can now enter those all on this one screen without having to select Next at the bottom and enter all the information for each allergy individually. You can compile their allergies. And then once you've entered all of their allergies, you now have the ability to enter the reaction on the same screen in which you entered the allergy. So if you click on this edit for reaction, you will receive a string of the choices that we have in our current dictionary for reaction. So you can update it right from this screen. If the reason that you need for reaction is not there and you do have to select the option that we have that says Other, See Comments, then you do in fact have to open up the edit for that allergy and proceed to go in and type comments. Also, if you choose one of the 5 asterisk reasons for reaction that calls a severity of severe, then you would need to go in and edit to make this severity severe. Our patient pharmacy entry has now changed in the fact that we do have these 3 asterisk fields here. Entering patient pharmacy is extremely important. It's going to become more important as we proceed forward and go into the electronic prescription that's going to take place in our near future. So getting patient pharmacy information in is very important. With these asterisks, the good news is you don't have to satisfy all 3, only one. So in the case here, we have definitely put in the state of NC. That's probably your preferable selection there. So if I put in NC and hit Next, I'm going to see all of the pharmacies for NC starting in alphabetical order. To make this even a more refined search, I could have put in CVS and NC and hit Next, and I would have only gotten the CVS locations for NC. There is an Add New tab that is available here. We are asking that you not use this feature. This feature will allow you to add a pharmacy yourself. If you do that, it's not going to have all the information that it needs, and ultimately when we do go to e-prescribing, it will not launch a prescription to that pharmacy. So if you find that a drugstore is not in this list that you need for a patient, we ask that you put in an IT ticket, and the IT staff will enter the drugstore appropriately. There are many other additional updates that the system is going to face. The majority of those are just going to be visual. They are not going to be functional, but I do want to mention some of the additional updates. Some assessments are now going to auto-complete. So after documentation, status of the item will change to complete automatically, or a message will appear asking if the item can be changed to complete. All IV fluids will now have a time associated with administrations. The detail footer button on the work list, you'll no longer have to click in last done column for item detail. There is a reverse sort on instance types. You will now see the newest first. The discharge signature report prints with the discharge packet. There is a spell check feature within Notes. If you right-click on a misspelled word, you will see the correction. If you let your session time out, you will no longer be allowed to enter your PIN to restore the session, but you will in fact have to enter your password with 607. The go-live plan for Meditech 607 is for November 14th, early in the AM. The idea is that it not be done during shift change. There will be a brief downtime expected. In-house support and coverage for the initial go-live period will be in effect. There will be more information to come as far as the exact downtime period and time frame, and an exact information about the support and how to reach in-house support during the go-live period. If you have any additional questions after viewing this video, please call 3250. If you call after our answering hours, please leave a detailed message and we will return your call upon returning to the office. We have a printed handout that also accompanies this presentation that if you have not already received, we'll be happy to get it to you if you let us know. We do have email via the Clinical Informatics team. That concludes this video.